Hello, everyone, and thank you for joining us this evening, either live or if you're watching the recording, a big warm welcome to you as well. Welcome to the Health Cafe this evening, and a big thank you to the Red Deer Public Library for hosting this event. I would like to start with a land acknowledgement to begin. We would importantly like to acknowledge that we live, work, and play on the traditional territories in Alberta of the many First Nation treaties, 6, 7, and 8, the Métis and Inuit whose footsteps have marked these lands for centuries, and the gifts provided by elders and knowledge keepers. My name is Rebecca, and I'm the Southern Alberta lead at Wellspring Calgary, and I'm joined here today by a passionate group of wonderful people who are committed to ensuring that no one has to face cancer alone. Cancer is not cancelled as a result of COVID-19. In fact, many of you may be feeling more isolated and afraid. This presentation is designed to give you an overview of some of the cancer support services and resources that are available for you in Central Alberta. You are in the very safe hands this evening of local experts who are here with open arms and an open heart to support you. In addition, I invite you to be part of the conversation, not just now, but moving forward. We want this Health Cafe presentation to be the beginning of a local collaborative effort to co-create and build more cancer support communities throughout Southern Alberta. I invite you to ask us questions at the end of the presentation by commenting on the Facebook field, or if you're watching the recording, we'll provide an email address that you can follow up with all of us, and we'll invite you to be part of this conversation moving forward. This really is just the beginning. I'm now going to hand over to Kerry Gagne, who is a Wellspring member, to share her story with you all.
Thank you, Rebecca. Hello, everyone. My name is Kerry Gagne, and I am a 48-year-old female diagnosed with a rare and curable form of blood cancer called AL cardiac amyloidosis. The AL is the form of blood cancer that causes the amyloid. The time and process it took to come to this diagnosis was a very trying one. I started out dealing and coping with chronic pain where I originally was connected with PCN, Primary Care Network. Then this hit me like a freight train. What a ride this would be, especially during COVID. In Red Deer, where I reside, there are limited resources that delayed a quick diagnosis, going to Calgary for a cardiac MRI and Edmonton for a bone marrow biopsy, which is where I was told that I may pass away at any moment due to the condition my heart was now in. So the race was on. Specialists in all three centers needed a positive result to be able to start the only treatment available to me at the time, which was chemotherapy. Unfortunately, a negative result came from the bone marrow. So then I had to have a fat pad biopsy done in Red Deer, which then gave a positive result. Formally diagnosed February 10th, 2021, I started targeted systemic chemotherapy injections February 12th, 2021. At that time, it was still unclear to me that I actually had cancer. In March, I was feverishly searching the web for answers as to what exactly I was dealing with. Just as I was ready to give up, I saw a tweet from AHS about an organization called Wellspring Calgary that was giving a Zoom class for patients and caregivers to connect and learn about resources for non-curable cancers. I felt an incredible rush and a relief of hope that this might be the place for me. I, of course, joined even though things had gotten a lot more real on March 9th, as I was told, yes, I have a form of cancer that caused the amyloid, and March 11th, I would have surgery to have an ICD, implantable cardioverter defibrillator, implanted for my heart. I finally knew I was not alone. They are all trying to help me, listen to me, which is huge for me as a person that feels very alone in this journey. I have a sense of belonging and purpose, which I am forever grateful for. Being a part of Wellspring, I'm connected with groups that I now call my family. This has been an encouraging experience. They listen, engage, share, and bring me back up when I'm emotionally, mentally, physically drained and discouraged. All staff and volunteers and the resources and the programs they offer have given me a sense of grounding, healing, and compassion. I am new to Wellspring, and I have not even put a dent into all that is offered yet, but I plan to take full advantage of everything they have to offer. They also have helped me by encouraging me to express and share my story, advocate for people like me about the effects that not only diagnosis brings, but what COVID challenges navigating the health system as a patient and lack of local resources that southern, northern, and rural Alberta areas are in need of. I would like to point out there are resources in Red Deer through Red Deer Regional Hospital, Cancer Center, and Primary Care Network. But in my case, where I have a rare unknown form of cancer with complex issues, the resources are limited and challenging for all involved. There are so many more possibilities and resources that I as a patient will do my best advocating on. I know it is possible. Anything's possible. And I encourage other patients and caregivers to speak up, share experiences, concerns, ideas, be heard. Things can't change without all of us getting involved and working together as a team. That team starts with you and I. Thank you for your time.
Thank you so much, Kerry, for taking the time and energy to share your story with us. I'm sure many people listening into this presentation may be able to resonate with certain aspects of your story. And the message is loud and clear that you are not alone, and that together we can do more. So thank you so much for sharing that. I just wanted to follow on from what Kerry has shared to provide a little bit more information about the wonderful organisation that Wellspring Calgary is. I'm just going to share my screen with you. Wellspring is a charity, but we are a lot more than that. We are a warm and welcoming community that offers programs and services that meet the non-clinical, emotional, social, and practical needs of people living with cancer and their caregivers and their families. At Wellspring, we look after all the non-medical aspects of a cancer diagnosis. We support all of the other things that make you you, that make you who you are. Our programs complement the services that Alberta Health System offers. Through our support services at Wellspring, we help to restore resilience, confidence, and quality of life. We connect people in a community who get it, who have a lived experience of cancer, either as a patient or a caregiver. All of the programs and services that we offer through Wellspring Calgary are completely free of charge and do not require a referral. What we provide is evidence-informed programming and resources for anyone living with cancer, any type of cancer, at any stage of the journey, including caregivers and kids. By being a member of Wellspring, you can access a wide variety of programs online and by the telephone in the comfort of your own home. We are currently not providing any face-to-face programs at the moment as a result of COVID-19, but we do really look forward to opening our centres in Calgary and offering face-to-face programs locally where you live in Central Alberta. We offer a combination of group-based and one-on-one programs. On the slide provides just an overview of a few of the programs that we're providing 5 days a week across a variety of timeframes, including some Saturdays as well. Our programs and services are offered under 4 main pillars. For example, with our educational programs, we offer Brain Fog, which is a 6-week course of dealing with the symptoms and side effects of brain fog as a result of chemotherapy. We have programs on returning to work and assisting people with looking at what does work look like for them as a result of their cancer diagnosis. We provide support in developing resumes and interviews or legal and employment matters. Our movement and meditation programs, which we're currently still running online, so you can access and join this community online in a group-based exercise or meditation program from the comfort and privacy of your own home. Some of these classes include Tai Chi, yoga, Qigong. Many of our members are in fact telling us that they're getting a better night's sleep because they may be joining one of our relaxation and meditation classes late in the evening and then drifting off into a better night's sleep. A really important pillar is self-care. We offer services and programs just for caregiver support, food and nutrition, men's groups, and groups like what Kerry spoke about earlier, groups for people who are living with a cancer that may never go away. And our all very, very popular programs are expressive arts, a great way to connect with people who get it and participate in a program or a hobby that you enjoy that makes you laugh or escape for a little while away from how you may be feeling at that current time. Programs such as creative journaling, digital storytelling, music classes, art classes, and Adventures in Art, which is a kid-friendly program. Some of our programs are tailored to specific groups. We have programs just for young adults, programs such as our men's group for men. We have an Indigenous cancer sharing circle, as well as family-friendly and kid-friendly programs too. I also like to point out that some of our programs are one-on-one as well. For example, we provide peer support services where you are connected with a well-trained Wellspring volunteer who's had a lived experience of cancer, either as a patient or a caregiver. You are able to then receive phone calls in the privacy and comfort of your own home with someone who gets what you're going through, someone who makes you feel less alone and you can talk to and ask questions. We also provide Money Matters appointments with one of our Money Matters coordinators. And this service is really where you can go to talk to someone about anything financially related or any complex questions that you might be having at all, or anything to do with paperwork. Any of those logistics that all just seem a little bit too hard, we can set you up for a one-on-one appointment with one of our wonderful Money Matters coordinators. And all of our programs and services are completely free. To become a member at Wellspring, all you need to do is to either log on to our website, which is at the bottom of our slide, and we have an online form, or you can give us a call and we would be more than happy to help you out on the phone at any time. I'd also like to acknowledge that we have a Wellspring Edmonton, who we work closely in collaboration with. So it doesn't matter which Wellspring you reach out to, Wellspring Edmonton or Wellspring Calgary, will both be there with open arms and an open heart to support you. I'd also just briefly like to add that my specific role at Wellspring Calgary is being the Southern Alberta lead. What that means is that my role is focused on expanding our cancer support services outside the boundaries of Calgary. We recognise the differences, some of which Kerry's mentioned, that exist in service availability and accessibility across the province. And as a result, Wellspring has expanded its services to regional and remote communities, including anyone listening who may be living in Central Alberta. An essential component of this expanded support is ensuring that any new programs we create or any new initiatives that we come up to better support you are designed by you, those of you who are living with cancer, either as a patient or a caregiver. We want our programs and services to be based on your needs, and those of you, and we want you to be involved in the creation, delivery, and sustainability of those locally driven cancer support services. Since launching our expansion of our services in 2020, Wellspring is very proud to say that we are supporting more members from across Central and Southern Alberta than ever before. Our aim is to ensure that those living with cancer, either those who've been diagnosed, caregivers, or the families supporting you all, that you feel more supported and less alone. I'll provide my email address and some additional contact details at the end of this joint presentation. Please feel free to write some questions in the Facebook chat, or we can follow up with you after the presentation. For now, I'm going to hand over to Tricia and Eileen.
Thanks so much, Becca. That was really important information, especially to hear about the opportunities for the patients. I just wanted to introduce myself. I'm a registered nurse, and I'm really proud to say that most of my career has been with our Red Deer Cancer Center, which is called the Central Alberta Cancer Center. And in the time that I've been here, which is 27 years, we've really grown and we've changed. So what's been part of my excitement is that in our last big move was to a much larger center, which you can see here. And we've been in this center for the last 7 years. And so when I started 27 years ago with a staff of 7, we've grown to a staff of 124. And with that, a lot of services and things have been able to be expanded as we grow and are continually changing as we try and keep up to date. But the addition of this beautiful center has really made a difference for Central Albertans to have that quality care, to be able to get that closer to home. One of the things that we really talk about is making sure that people are aware that there's a real dedication, that cancer care is really about being able to be in your house and being able to have some of those quality services close to your home as much as you can. And so it's really about a work that we do, and we're trying to make sure those connections are there with our family network, family physician networks, and our AHS services and our community organizations. But for us, making sure that we can have those, most of those care and services close to home. And we've really made a lot of changes with that, even in some of the cancers where we used to have to always send them off to the bigger centers, we're able to do a lot of those closer to home as well now. Just kind of a framework and information for you to look at as far as the cancer network, because we're all connected, even in the province itself, is that we have 2 tertiary cancer centers, of course, in Edmonton and Calgary, and then the 4 regional cancer centers, which are Grand Prairie, Lethbridge, Medicine Hat, and ourselves. And as far as those regional cancer centers go, Red Deer is the busiest of those as we continue to move forward. We have 11 smaller community cancer centers that, again, supply services closer to home. They don't do consults there, but they can do the treatments there. And we also help as far as that closer to home initiative goes in supporting our 2 pediatric cancer centers, so Alberta Children's and the Stollery as well. So for us, just to kind of be familiar with our resources, we are open 5 days a week, and we have medical oncologists, we have hematologists and radiation oncologists. And what that means is that we can see patients from the very beginning of their journey and be able to get those consults, treatments and follow-ups as we continue to help the cancer patients on their journey anywhere along that trajectory. Occasionally, we might need some people to still travel. For example, some of those kind of rare cancers, or if we have some acute leukemics, there still is a need for them to be going to the Edmonton or Calgary. But like I said, a lot of those treatments now we're able to give those closer to home, like our head and neck cancers, where previously they would have had to have gone. While we've expanded and grown, that means that we have lots of those supportive services that have really been able to be available locally too. And we're going to talk more about that. And Tricia, my counterpart here, will introduce herself and talk more about those too. A lot of the things to be familiar, just like what Becca said, is about COVID and how we've continued to be business as usual and making sure that we were able to service our patients even with the pandemic. There's been a lot of virtual visits or supports that we've been able to try and modify. And we have really trying to make sure that people have that contact and be able to get a hold of someone. Our cancer patient navigators are really important pieces on that. They really look at making sure from the very beginning part of a cancer journey that they can talk to patients be able to listen and be able to know and provide some of those services that might be available. And then phone number for our cancer patient navigators is on the slide. And we've also expanded on a telephone triage nurse. So we've really tried to expand on a resource nurse that can be able to talk to patients if it's an emergent or urgent, or just even a routine call, that we can make sure that they can contact people and be able to have that registered nurse call them back and talk to them through whatever their concerns are. And I'll hand it over to Trisha.
Thank you, Eileen. Good evening, everybody. My name is Trisha Hutchison. I am one of the social workers at the Central Alberta Cancer Centre. If you can think back to the map that Eileen had showed you a little bit earlier, the 11 community cancer centres is where my role comes into place. I'm housed out of the Central Alberta Cancer Centre, but I have a colleague who looks after patients coming to the centre here in Red Deer. So social work is available here for you at the Central Alberta Cancer Centre. You can self-refer, you can speak to any of your healthcare team members for referral. Social work is available for patients, families, friends, and we can speak with you in person, on the telephone, or via Zoom or telehealth. At the bottom here, I've got a link in black there, the counseling and support, which will take you to the supportive care page for Alberta Health Services. And there's a lot of information there for patients and families describing the different services that we're able to provide. Social work support. So what might a social worker help you with? Well, many different things. We provide support around resources and practical types of counseling. So looking after financial concerns that you might have, whether that's a loss or a decrease in your income. Medication coverage. There's other plans out there, other options out there that we can help you to look at. Accommodation, transportation, navigating some of the more complex government programs or employer benefits that you might be dealing with. Discussing information about legal documents or personal questions, and then of course providing advocacy and support and referral. So you know, you can always call your social worker, and if they don't have the answer, they will be more than happy to find someone that can answer the question for you. In addition to that, we provide supportive counseling related to quality of life issues, coping strategies, managing stress, anxiety, grief support, and referral to additional resources. In addition to that, we do have some support groups. This at the bottom there where it says classes, groups, and events is a link again to the groups and classes that are available through the supportive care page on the website. In addition to social work here at the Central Alberta Cancer Centre, we also have a rehabilitation department. We have an occupational therapist, a physical therapist, and speech language pathology. Some of the common things that may come up that you might be able to access services for any of the rehab professionals might be pain. They can help you with range of motion, weakness, difficulty with daily activities, memory, stress, sleep, sexual health, fatigue. There's many different things that our rehab department can assist with. Referral criteria is that you have to have a functional impairment due to a cancer disease process or treatment. Again, you can self-refer or speak to one of your healthcare team members and they can refer for you. And in addition to that, we have dietitian services here at the Central Alberta Cancer Centre. And it's for all patients who are diagnosed with a cancer or with a cancer diagnosis and registered within a cancer center within Alberta. So any of the tertiary, community, or regional cancer centers. When should you see a dietitian? Well, poor appetite, weight loss, trouble with bowels, eating difficulties, anything that has to do with your intake of food and concerns or questions that you might have about diet and nutrition. To access a dietitian, again, speak with a healthcare professional or someone on your team, or you can contact them directly. Just an important, thing to note is that all of these services are here to support you. Please feel free to ask. Please feel free to contact us directly.
And so a couple of things that we wanted to talk about, and just as far as the services go, when our newest building was built 7 years ago, the real addition to that was about radiation therapy and the ability for patients to have treatment, where previous to that, for the years prior, you would have to go to Edmonton in order to get or be referred to Calgary. So we were very excited when that came, and it's really made a difference for patients as far as what their decisions make. It might even be that there's a decision regarding surgery if they can look, for example, with our breast cancer patients and have breast conserving surgery if they know that radiation addition to that is equal to the total mastectomy. It's exciting because radiation has changed so much over the years too. It used to be where there was a lot of side effects and a lot of different skin issues that we might see, but our radiation team is very up to date with the state-of-the-art equipment, and it's really about that targeted, individualized cancer treatment. And when targeted, it's a real focus. So it's looking at just one area, and then if there is side effects associated with it, it will be related to that local area. But they've done so much as far as advances go. The preservation of surrounding tissue has really been one of the big changes that our radiation department can continue to be able to provide for our patients. We want to make sure, just a bit of a funny note, that you know that it's not going to make you radioactive, but you know, if you wanted to get those superpowers, unfortunately, we may not be able to be the ones that give it to you, but we'll try anyway to give the best that we can to support you. The other thing that we have, of course, is systemic therapy, which was commonly always called the chemotherapy, but we've really tried to change some of that terminology because we have so many new cornerstones that we are working with in systemic therapy. The difference between that radiation and systemic therapy is that it's something that you take that's going to go through your body and thereby look at going through the bloodstream and destroying those cancer cells. When I said there's lots of different advances, we still have our chemotherapy that we give that's traditional, and we have our radiation and our surgery. One of those newest cornerstones that we're offering here is immunotherapy, and we're also doing targeted therapy and a hormone therapy. But it's really been an expanding area for us as far as systemic goes, and our medical oncologists have stayed up to date on those as well. So it's very much something that's offered here locally as well. When we give the systemic treatment, it can be either intravenous or it could be oral. There's a lot of expansion into our oral treatments that we give now, and injections that we do as well. And if you think about the most common side effect that we have when we give the systemic therapy, a lot of people still think to that traditional nausea and vomiting, but it still is the fatigue that is our #1 side effect that we deal with. So a lot of our resources are looked at about supporting and educating about fatigue management. We also just wanted to say that we have a really important pharmacy team that is available Monday to Friday as well. And when do you think you might call them? Well, and there again, the call number is on the bottom of that screen. But they're really dedicated to making sure that there's an understanding about what medications work. They really look to see if there's any contraindications. They discuss and will look into any alternative medications, knowing side effects that can happen with that too. And they work as a team with our community pharmacists, and really, they're really great resources for people to use as far as being able to have any understanding or any explanation. And they often will even call our patients to see how they're doing as well. I'll hand you back to Tricia.
Just going to cover a couple of other resources that we have within cancer care very quickly, because we're running out of time and there's lots of people that need to speak. There's lots of great information. OASIS, the Sexual Health Program, is a program we have through cancer care. It is provided both in the north and the south. They're clinic nurse practitioner and health consultants. They will do counseling for singles or couples. And again, the website link is on this particular slide. So when you're able to take a look at that or make a copy, you can go directly to the OASIS program there. Another program, specialty program that we have for navigation is the Indigenous Cancer Patient Navigation Program. They are registered nurses that work to bridge Western medicine in cancer care with traditional ways. They help to guide First Nation, Métis, and Inuit cancer patients and their family members through the complex system. For the Red Deer area, it would be Red Deer North. The number is listed there, and it's free and confidential. And finally, another one of our programs we have is the AYA program, Adolescent and Young Adult Patient Navigator. Again, these are specially trained, not registered nurses who work within a multidisciplinary team to assist young adults to live well with and beyond their cancer, ages 17 to 39. And again, there's a link there for the brochure, and there is both a North and a South program available.
And we also have an external web page with a lot of our resources for patients and families with the website there for you to see. And the importance of this is that anyone can get to this. We have different categories: prevention and screening, just diagnosed, in treatment, after treatment, supportive care and living, and also a way to register for classes that we have in regards to fatigue, or even of our links to the Wellspring as well. With this, it's important to know that we have videos embedded. So there is different books or different resources, but we also have a group of 40 videos that are specific to cancer care that were done in cooperation with Saskatchewan and Manitoba that are really good. They're short and up to date and give you lots of good tips on brain fog, sleep disturbances, fatigue management as well. And lastly, there's just, like I said, that link to those resources and being able to see some of the different side effects or management and being able to look at things as they might be occurring if you can get to the website.
And finally, just some parting words. If you've got questions about your treatment, side effects, any concerns, please talk to your healthcare team. Please talk to your family physicians, contact home care. We're all working together. We work with Wellspring, the Alberta Cancer Foundation, Canadian Cancer Society. There's many fantastic groups and organizations out there and lots of good information. So please feel free to contact any of your healthcare team members. And I think we're going next to
Julia.
Yeah, Julia with the Primary Care Network.
Hi, everybody. Thank you for having me here tonight. My name is Julia Valance, and I work for the Red Deer Primary Care Network. I'm also a registered nurse, and I also am a program manager for our mental health team. What I wanted to share with you tonight was just some of our exciting programs that we offer as well. I wanted to just talk to you about how we may meet you at any point during your journey with cancer. We may meet you even before that begins. You may meet with some of or talk with some of our support nurses, our LPNs, who do prevention screening and testing. You may meet up with some of our family physicians who may be discussing with you that initial diagnosis. And then you may connect with us along the journey through a lot of other programs that we offer. We have family nurses, so registered nurses, mental health counselors, we have pharmacists, we have rec therapists and kinesiologists as well, working within the family physician team. So you may meet us all along that journey. Some of our great programs that we offer are things like helping you to quit smoking if that's something that you're looking for help with along that journey. We also offer lots of connections to resources in our community. We're very well versed with what is going on in our community and can help you with that. We certainly do a lot of other things. We do nail care. So sometimes when you're living with cancer or you've gone through cancer treatment, you may end up with some noticing that you're not able to feel your feet or your hands as well as you once could. We can do nail care to help with that if you're not able to feel those limbs anymore. We also do a lot of great counseling services. So if you're feeling anxious going through this journey or after, we're there for you. If you are feeling depressed or lonely or you're grieving, we're also there for you. And we're there for your families as well. If you are wanting to access any of these programs, you will need to reach out to your family doctor and they can do a referral for you. A lot of our other programs, which are group related, are being run right now virtually. We have continued to do this along the way. And once we are able to open up more, we will be offering in-person groups again as well. We have a variety of groups, lots of which would be very pertinent to you. And Carrie had mentioned that she had connected with us early on before she knew she had cancer. One of the courses she took was our persistent pain program. And that's a really great program that you can connect with. And we really talk to you about a lot about how your mind and your body need to work together to be able to help you influence how you're feeling with that pain. And so that might be something that you experience or want to take during this time. We have a happiness basics program, which is fantastic for people who are wanting to feel a little bit better. We offer a lot of great skills that you can learn about in class, and you have that connection to others that are also wanting the same thing. We have an anxiety to calm program, which is fantastic as well for anybody who's suffering or living with some sort of anxiety or worries and concerns. And that's what cancer does, is it can make you have those worries and concerns. And so we have a great program to help with managing those feelings and can get you on a better path. We also have a Journeying Through Grief program. As we know, cancer can cause all sorts of feelings, and grief can be part of that. And so certainly you are welcome to attend that program as well. We also offer a sleep program. So if you are struggling with sleep, especially insomnia, we have a program that might be for you as well. Those are just a few of the very many programs that we offer and the ones that I wanted to touch on tonight, but feel free to reach out to us. I will post our phone number in the chat. You can reach out and call, or you can reach out to Rebecca and she can connect you to us. So thank you very much for having me here tonight, and I will pass myself over to Marley and Dr. McCall.
Thanks, Julia. And thank you to all the presenters before Marley and myself. I'm a family doctor, and I've been in Red Deer for close to 35 years. And the area of my practice now is specifically helping people who have bothersome pain and symptoms, particularly with illnesses, including cancer, that may never go away, chronic illnesses, and in some cases, illnesses that may significantly limit someone's life. The name of that special area of medical practice is palliative care. And some people have heard of palliative care and think that it's much more specifically to planning care at end of life, but I want to make sure that everyone attending this webinar and able to watch later knows that we're much more than that. The specific supports that I'm happy to tell you about relate to potential hospital stays during your investigations to confirm your cancer diagnosis, or complications from your cancer itself, or complications from cancer treatment. That's the role that I work in almost every day as part of our Central Zone Palliative Care team. In the Red Deer Regional Hospital, Unit 32 is specialized for oncology, that means cancer care, and palliative care. I'm part of a palliative care team that encompasses not just our hospital, where we see patients in the ICU, emergency department, surgery, etc., for all sorts of bothersome pain and symptoms. And also we have a branch of our team that works throughout all of Central Alberta, and Marley will tell you some more about that. Our zone goes from Wetaskiwin in the north to Didsbury in the south, and from the BC to the Saskatchewan border. So if you're watching in from those areas, you may well be able to use some of our services at some time. We have team members within the hospital on Unit 32 who have many of the areas of expertise you've already heard about. They do a lot of the same things that the cancer care team can do through the cancer clinic. But when you're in the hospital, our cancer-focused care teams are very busy taking care of folks that are coming on a day-to-day basis. And our physios, dietitians, pharmacists, discharge planners, and spiritual care team can also be there to help you. We work intensively to try and help control pain and symptoms. and help people get to where they want to be, which for most people is home. If you're in a rural hospital, getting care for some of your cancer-related issues, some members of our team may be visiting you there and helping your family physician as well. And when you're ready to leave the hospital, we can refer you to our community team members who will continue to work with you at home to help with many things, everything from caring from those indwelling lines you may have for your chemo, dressing changes, managing excess fluid in your body. So there's many things that our home care team can do. I just also want to highlight that we work very closely together with our cancer care team members in every 2 weeks at the Red Deer Cancer Center. A member of our team works together with some of the cancer care support team to provide a complex pain and symptom clinic. If you have symptoms that are really bothersome to you, please feel free to talk with your cancer care team members and request a referral to our pain and symptom clinic. And we augment some of the services that can be available to you and help follow you when you go home to the community as well. So I'd very much like to hand over now to my colleague, Marley McDonald, the nurse practitioner with our palliative care Central Zone team. Thanks, Marley.
Thanks, Maureen. And I just have to say thank you so much. I am also so inspired by just listening to the services that are provided by all our partners that we work with. I'm so appreciative of what we have here in Central Zone. Again, going by starting off with what Maureen says, our services extend not only from the hospital, but very often we work very closely with clients and families at home. We're a branch of continuing care services in Central Alberta, or you may know it more as home care. The purpose of our program is very simply helping individuals live fully, and sometimes that's to the end of life, but with dignity and comfort. The purpose of our program, or the goals of our program, is to provide in-depth assessment and support covering all aspects of individual and their needs, such as disease management, physical symptom management, psychological, spiritual, social, practical, and then when time, end-of-life care. We also extend our care to the time after death for family. Our team is fairly extensive and very similar to some of the teams that you've heard in the Cancer Center as well as in the hospital. We also have a very extensive team. We have actually 15 specialized nurses that work across our zone. So many of our communities in Central Alberta have access to our specialized services. And, you know, even if not directly in your community, they are usually covered by a nurse close by. We have myself as a nurse practitioner. We also have 6 wonderful family physicians that have special interests in this specialized type of care that are access to our team and able to reach out to family physicians in all across our zone. We also have the specialized care of a continuing care counselor, and she offers much support in the way of counseling, access to maybe financial concerns, as well as offering many coping skills that we utilize very much in managing symptoms, as well as just strengthening the unit of the family in being able to support a loved one with cancer at home. We also are supported, our team provides many services of education, not only to family, but also to many healthcare providers in the zone. Palliative care is something that all of us in healthcare, our aim is that everyone should be able to engage in palliative care and supportive care. And so it's our purpose to offer as much education to different team members as well. And I'd also like to just make a special mention of another team that is very vital to our community support services, and it's called the Assess, Treat, and Refer team. They're a pivotal part of our team. It's made up of emergency medical services or paramedics that have specialized training in symptom management and supportive care, so that we might be able to, another branch that we're able to support families to remain home and to manage all the services that they need. They work very closely with our team, and they also access many other services in the community. And I think that's an overview. I just want to say that anybody can access our services. It doesn't have to be a referral through a specialist or a physician, that a family member can access our services. And that is through the continuing, and I always get mixed up when I'm with the Central Alberta Cancer Centre, because we're very similar acronym, but we're the Continuing Care Access Centre. So, and we are a toll-free number, which I can provide as well afterwards. But again, like I said, I want to make sure that everyone knows that anyone can access our services.
Thank you, Marley.
I'm passing it back to Maureen, I think.
Thanks, Marley. I really appreciate, Marley, that you added in about the really important role we play with education. Our team helps teach family doctors, pharmacists, social workers, respiratory technicians, EMS, and as I think I already said, many family physicians in the principles of palliative care through a course called LEAP. And Marley has a very important role in teaching many caregivers about how to help navigate some of those really difficult conversations that you may need to have with your family and your caregivers throughout your care journey. I'm very proud of all the education that our team does. Now, according to my watch, we have about 16 minutes left. I am watching our chat box to see if there are any questions from viewers. And we'll be happy to give people some time if there's a question that you would like to pose. You're free to say if you'd like to address a question to one of us or our team specifically, or if you have a general question. While we're waiting for questions, is there anyone else in the team who would like to add something else to the information in this session? Some very important nugget that they would like to share that maybe they didn't get a chance to in their first presentation?
What I might do is, thank you for that, Maureen, is I'll share my email address. So what we want you to know is that we've given an overview of some of the cancer support services that are available to you, whether they're clinical based or non-clinical and non-medical, such as Wellspring and some of the programs through the Red Deer PCN. We've really only started to scratch the surface on all the support that is out there. And what we would like you to do is, if any of this triggers a question or something you want more information for, you can reach out. So I'll put my email address on the screen for you now. And what we are going to do is filter any questions that come through to me to all of us as a group. We work very closely together as a collaborative group, making sure that all our support programs and services complement each other instead of doubling up. So if you email me at rebecca.p@wellspringcalgary.ca, please be reassured that we will get back to you. Your question can be directed at one of us in particular, or we will work as a group to make sure that we can respond, incorporate you into the conversation, hear your needs, your ideas, and make sure that you're getting the support that you are looking for wherever it is that you live. We are here for you. We are really trying to get the message that you're not alone in this journey. Reach out to us. and we'll be sure to connect you to the services you're looking for, or perhaps we can look at creating something if it doesn't already exist. I'll just pause there to see if any questions have come through. No questions currently, so we might end there unless anyone has anything else to say. I want to pass over to Kerry to finish up.
I just want to, oh, my voice is gone. Pardon me, it was chemo day today. As a patient, I do want to say, even though I've touched base with some of these things, I still don't know everything. It's not like there's a list given to you right away. So I believe there's also time where this is recorded and people can still comment and ask questions, and that I still have many questions. I'm still navigating the system. I still don't know everything I need. And because I'm complex, it's hard for my teammates, which is everybody, to help me. And it takes time, but it's you have to speak up or we won't make this better for everybody. Thank you.
I see a question in the chat box here. It says, I live in rural Alberta. Can I access the PCN programs? Definitely you can. Any of our groups are available to you. You can attend those, whether or not you have a family doctor in Red Deer. If you are looking specifically for individual counseling or you're wanting to speak with a family nurse, you do need to have a family doctor connected to Red Deer PCN. However, there are a lot of PCNs rurally as well. And if you want to reach out to me, I can try and find out which PCN and what service would be best for you. So I hope that answers the question, but definitely we want you to come and join us. We want to be there to help you. Thank you.
I know that the one thing that I think that I hear when I listen to the stories, because I think we learn more from stories too, like we can talk about different resources, but it's through sharing of stories in places like Wellspring or places that get together that you start to really understand it better and know what's available for you. And I think really stressing that everyone's cancer journey is theirs. It's really about knowing that you are part of that and your team is trying to support you on that journey as best you can, but it's really yours.
I actually have a personal story that, my father over this period of time actually ended up developing colon cancer throughout the COVID time. And I just wanted to say a really great big thank you to the Cancer Care Center. They did an amazing job with him. They were very supportive. And, like when my dad was really struggling, he was able to connect very quickly to your navigation nurse, as well to the pharmacist, and all the questions that we had, they were answered. And I just wanted to say a really great big thank you. He is feeling a whole lot better now after he has completed all of his chemotherapy, and he's doing really well. So just a great big extended thank you to all of you guys. So that just shows that we all have a journey, even if it's not us, right?
Absolutely, Julia. The harsh reality is that 1 in 2 people will be diagnosed with cancer in their lifetime, which means we are all directly and indirectly involved in one way or the other in a caregiving role or potentially as a patient. So our arms are wide. We have many services available in Central Alberta. We hope that we haven't overloaded you all with too much information, but reach out, have a look on the internet if you have access for some of the services that have been mentioned tonight. And this recording will be made available so that others can continue to benefit from the information we've provided. Share your stories with us as some of stories have already been shared, because that is how we can come together and learn, so that we can work together, as Kerry has emphasised tonight, to make sure that we are working as a united team to support you all, regardless of where you live. Your cancer journey is your own, and we are here for you the whole way. Thank you, everyone.